from Logan Health, we welcome Patient Family Advisory Council Chair Pete Newberry. Good morning, Pete.
Good morning.
I didn't realize your chair had wheels on it, though, Pete, until we met here moments ago.
Yeah.
Who else do we have, John?
Oh, we have the Planetree coordinator, Cassidy Lilienthal.
Hi, good morning.
Good
Hi.
morning. All right, so let's start out with you, Pete. Help us understand what the Patient Family Advisory Council is all about.
All right. Well, it sounds impressive and scary, but it's very, very, very simple. Basically, what it is the what we call PFAC. That's the acronym.
Mm-hmm.
It is basically when patients, families, and staff, we get together to improve care, listen to each other, and things change from that. We basically advise on programs and come up with solutions designed to make things better.
Hmm.
Yeah.
And so how do you go about doing that?
Well, that's a great thing. That's where the staff comes in from the hospital with Cassidy and those of us around the table. We get together. They give us presentations. We tell them what we think. And that's the biggest thing, shared experiences around the table to get everybody together.
Is this more to get people more involved in their own health care?
Absolutely. Patient-centered healthcare is really what Logan is aiming for. That's vision, mission, all that.
Mm-hmm.
And having a lot of people throughout the community, different walks of life, makes a huge difference.
Cassidy, we'll talk about Planetree here in a little bit, but I want to kind of get it from your perspective now, the work that Pete is doing.
Yeah, so this council really improves relationships between patients, families, and staff. But really getting that lived-in experience, right? So like we have surgeons that may never have their surgery that they perform every day, but our patients have had them. And so when we talk to them and find out how they feel, what they're experiencing, we really are getting that perspective that we will never have as healthcare providers.
Oh my gosh, yeah. I mean, I hope I never break my leg.
Me too.
But, it would be nice if the doctor knew what that was all about.
Exactly. So when we hear from our PFAC members, our patient family advisors, they're the ones that tell us this is what it feels like when you don't get the accurate diagnosis or the accurate communication or whatever it is that they want, when they don't feel comfortable. This is what it feels like. And then we make changes based off of their experiences.
The thing that I remember how helpless I felt when I'm watching my wife being wheeled into surgery.
Right.
Just how helpless I felt. I can imagine how a child would feel. I can only even begin to imagine what, if this were a real life, it could be a life-ending procedure.
Well, I got to tell you, from your description right there, you'd be great on PFAC.
Yeah, we're recruiting.
Absolutely. It's about what you experience and the feelings, and your feelings are very valid. Your wife's feelings very valid, and the hospital needs to know that.
And I'm sure that this isn't the first time you've heard something like this. What can you do to make a family member feel a little less vulnerable?
Oh, there's so many things. It can be as simple as a warm blanket, right? Like it could be a healing touch. There's so many things that we can do to just make people feel that compassion and empathy that we do have. I mean, most of us got into healthcare because we just love helping people. It's the confines of healthcare that make it sometimes difficult for us to meet that. So
I'm fascinated by this first point you made. I mean, nurses learn how to give shots. EMTs learn how to give shots, and so you know what that feels like when you get a shot. But I don't know how many brain surgeons have ever experienced brain surgery.
100%.
Yeah. And I've had total knee replacement, and it made me reflect on the guys who replaced my knees,
Yeah.
how are their knees doing? They still have the original equipment manufacturer stuff.
Yeah.
So
So that's why we need our patient and family voice. So we have lots of opportunities. We do have we have a PFAC, so you can join PFAC. You can go actually on our website to join that and see what we do. Read our minutes. Look at what we do in the council, the different initiatives that we do. We have some pretty cool stuff. We helped design a patient guide for all inpatient adults. We updated to a 24/7 visitation policy. Looking at as healthcare workers, we're there for a lab draw. We're there for a 12-hour shift. We're there for a procedure. That's a transient time, fleeting time in a patient's life. But really, it's the families that are with our patients more than ever, taking them to appointments, taking them to the doctor, taking them to the hospital, getting them their meds, waking up with them at night. So why not have those families with them as our partners in healthcare at all times? So that's why we changed our visitation policy.
Boy, you've already done some good things.
Yeah, I mean, being somebody with disabilities, I experienced back in the 70s having to have procedures and stuff, and they kicked my parents out.
Right.
What?
We're done, and we've changed that here. So that's a huge thing. Can you imagine being a child and they have to go?
yeah,
It doesn't work that way anymore.
So this is something you've been dealing with since you were very young.
Correct.
Yeah. The Americans for Disabilities Act, I want to ask you about that
Yeah,
because
sure.
you've experienced it firsthand, and what a difference it must have made in your life.
It absolutely. Compared to the 70s, oh yeah. I mean, cutouts in the sidewalk, and people's understanding is far beyond what it was, and it's to the point. Not too long, 20 years ago, I was feeling really put down. There were things that I could do, but I was a burden. I'm not a burden anymore.
Yeah.
Everybody wants to help, and I love it.
Well, you certainly are engaging in life, which
I try.
Well, you are, and helping at the hospital.
Yeah.
But this is something you probably could not have done if we hadn't made it more accessible for you.
Oh, straight up, absolutely. Even down here on Main Street and First and so on, there's always big steps to get into places. And I do use a wheelchair. If I don't know where I'm going, if I know where I'm going, I can use canes and such. But things have changed for the better. Yeah.
And buses that kneel.
Mm-hmm.
Oh my gosh.
Oh yeah.
Absolutely.
Things like this that
Yeah.
have been created, and the wheelchair lifts.
Yeah.
And are you able to drive?
Yes,
So you're able to do all that stuff too.
I am. Yeah.
So you can participate in life even beyond.
Without a doubt, yeah.
Yeah.
And the hospital has the volunteer opportunities that I've been afforded are amazing. Being on PFAC and now being working with Cassidy as being the chair, it's a lot of fun.
Yeah.
yeah, that's right.
Oh boy.
Yeah, helpful.
Yeah. Well, let's get into Planetree. This
Okay.
is another part of that, and we'll do that right after this. And today we're talking about the family getting involved, and we have Logan Health Patient Family Advisory Council Chair Pete Newberry and Planetree Coordinator Cassidy Lilienthal. So Cassidy, now it's your turn. First of all, what is Planetree?
Okay. So Planetree is an organization. It's a global nonprofit organization that partners with healthcare organizations to advance the philosophy of person-centered care. Person-centered care, then, is focusing really on the needs of patients and seeing them as people first. So we're not just a diagnosis, we're not just a room number, but we are people who are complex, and we try to use Planetree's framework within Logan Health to accomplish that. It's very strict. It's lots of research, a lot of evidence has driven this framework to help us accomplish it, because it's no easy feat. It seems like it would be easy to say, oh, you treat people as people and you personalize healthcare. But really, as we talked about, like from the 70s and from on, healthcare is not designed that way. But organizations across the country and across internationally have been trying to move to this philosophy of person-centered care.
I had a friend in Denver who was an ophthalmologist, and I remember asking him one time, I said, how in the world did you manage the first time to cut into somebody's eye? How did you, how do you do
Yeah.
that? I mean, but how do you
Skill.
do that? How do you prepare yourself for that? And he said, well, first of all, my instructors knew when I was ready. But he said the other thing is we can't think of it as a person. You have to think of it as a surgical field. And that's how he was able to do this. Now, that didn't mean he didn't care about his patient, but,
Yes.
but it means he had to divorce himself from the idea that he was cutting into somebody's eyeball.
Absolutely. Yeah, there are definitely times where we requiring intense focus on the
Yeah.
things that we're doing, but in the long run, right, everything boils down to that person that's there right in front of us and looking at them as a human, as a person. So I don't know if you realize Logan Health Whitefish, which at the time was North Valley, partnered with Planetree
Sure.
back in the early 2000s. And so Logan Health Medical Center and our roughly 50 clinics have partnered with Planetree now in 2024. So we are on a new journey in the system to move to this person-centered care, and it is quite a journey.
Now, my wife worked for North Valley, and she called it patient-centric care.
Yep.
Just intense focus on it. And I experienced it having surgery up there. They have you in before the surgery, on a day before, show you the room you're going to be in and everything. So it's like, I guess it just makes you more at ease. And then they give you a massage
Yeah.
before your procedure. I'm going, this is like a country club. This is
Yeah.
I
great.
can dig this.
Yeah, we offer lots of different services that meet patients where they are, right? We offer aromatherapy, we have naturopathic oncology, we have pet therapy, we have art therapy, we have all these different things to just try to meet people in a different way.
That's when my first son was born, or my only son was born. I had a son and a daughter. I was this was back in the early mid 70s, and I was one of the first men to ever go into the delivery room.
Oh,
And of course, they made me take this mother-baby course, which I thought was fantastic, learning how to hold a baby and change diapers and do a bath and all that stuff. But one of the things was they showed us the film, which I flunked. Oh man, I had to get up and leave the room, and I thought, this is not going to work. So the next class, they took us actually into a delivery room and showed us what it was like, and that relieved a lot of my anxiety.
Yeah.
So I take your point here. If you can see where you're going and understand what's going to happen, boy, it takes a lot of the fear out of it.
Yeah, and just, as healthcare workers, we've seen that room a million times, so it means it's normal to us. It's not normal to you. And really looking at it from that empathetic, compassionate viewpoint is different.
Yeah. This room itself, Robin and I spend
Oh, yeah.
5 hours a day in this room. It's no big deal to us, but you guys coming in, it's like, oh boy, what do I do? Where do I go?
Exactly.
Yeah.
Exactly.
And now you're relaxed. You're just talking to us like you would any other time.
That's right.
absolutely.
Yeah.
And like we try to make everything patient-centered. You have made it very easy for us to come in and make a smooth transition into this interview. So
Thank you.
that works too, yeah.
So let's talk more about the Planetree Guide and some of the changes it's made at Logan Health. We'll do that next.
Well, our conversations today with Logan Health Patient Family Advisory Council Chair Pete Newberry and Planetree Coordinator Cassidy Lilienthal. And interestingly, Planetree has been around since, when did you say it started at North Valley?
Yeah, the early 2000s.
Okay, and then they adapted it here a couple of years ago
Yes.
at Logan Health. I think I've noticed a difference at Logan Health going up and visiting patients.
Thank you.
You know, I mean, it seems like the nursing staff and the different floors and everything, it can do, not just for the patient, but for those visiting. Where before, the difference, of course, North Valley was what, 25 beds?
Yeah, it's
How many beds at Logan Health?
yeah, we have over 200 fluctuates. Yeah.
So, you know, my wife spoke about the culture when she came to Logan. Gee, I miss North Valley. So it's nice that you're bringing that.
Yes.
How have you been able to help guide positive changes in this bigger sphere?
Yeah, so some things seem very simple, but we are definitely in a unique industry, humans helping humans, right? It's very unique. So we updated visitation policy like I talked about earlier. That's a huge one. We've also renovated 12 rooms in our progressive care unit. We updated 31 in our surgical unit, 40 in our acute care unit. This is just to provide a more healing, comfortable environment for our patients. That is person-centered care.
Okay, so that's the patients as well as the families who can visit now 24/7.
Yep.
Which, you know, I remember when I was a kid, you have to be there between certain hours, and you have
Visiting
to leave.
hours, yeah.
Visiting hours are now over. I'm glad that has gone away. Now, what about the general public? Is there a way for us to get involved?
Yeah, so we are still recruiting for our Patient Family Advisory Council. Really, we want more voices to help us guide healthcare. And then we have a really good opportunity for this patient experience community engagement event. We are hosting these events, and you can visit our website to find out more about that. That is logan.org. /patient experience. Is that what it was, Pete?
Patient engagement. Excuse me.
Patient engagement. I'm sorry. So yes, so please join us for those events.
What happens at these events?
Yeah, so there's about 30 community members we're inviting, along with quality and safety teams, patient experience, myself, and our Patient Family Advisory Council, to just meet and get ideas and answer questions, and people express concerns or the good things and the bad things that they've maybe had happen in their healthcare journey. And then we can use that information to make changes. And then more importantly, we post it back onto our website to show how we've fixed things, how we've accomplished things. Something as simple as, like, we had some patients say that they didn't like the location of the cashier's office at the medical center. It was kind of in a place where they felt uncomfortable to sit there and wait to pay your bill or something like that. We moved it. Because we listened to them and said, okay, that's a simple thing. We can fix that. But as a person like working there, I wouldn't know that that was a thing until someone told us.
That we could, absolutely.
Yeah.
And also with the patient engagement experiences is that people may be out there listening right now and going, oh, people are picked to do that. And no, we want voices. And so if you're out there listening right now, you could be in one of these engagements and tell us how you feel. That's important. Or you can sit in your house and go, I don't like Logan Health. Or you could come out and tell us what you feel.
Now, is this kind of a relaxed atmosphere that these take place in? Because engagement sounds like a wrestling match.
It's like a listening session, basically, like us listening to you.
All right.
Right. So our chief medical officer will be there. Our, the big team of people to just say, welcome, and find out what you want, find out what you need.
Kind of like focus groups.
Yeah.
Pete,
Just had to give it a fancy name.
Absolutely.
You have been in and out of hospitals, I suspect, a good portion of your life.
Correct.
Talk with us a little bit about your experiences, maybe something that really got you to feeling like you really wanted to be a chairman of this advisory council.
That's great. Well, my biggest experience with healthcare is all my doctors have been great, no matter what. But because, they go to school for that, the nurses make all the difference for me. And even when things were, my parents couldn't be there or what have you, the nurses were always there. And they listened. And I guess that's why I wanted to be on the council. A friend got me into it, and I really felt that the committee, we advise. It's not like the staff comes out and goes, this is what you're going to do. No, we get to advise them, and then together we come up with solutions.
I just think it's fantastic that you're doing this. I really do. I think that when you have somebody who's actually experienced hospital situations as much as Pete has, boy, you're a voice that we need to listen to you.
Thank you.
See, and I was thinking about the nursing staff also. I remember my first total knee replacement. They get you up 2 hours later to go for a walk, and you're going, oh my gosh, but the doctor didn't advise me of it, that this was part of the procedure. But just knowing, being assured, well, your knee is totally weight bearing. Don't worry about that. The nursing staff are the ones that put you at ease and help with the transition.
Yeah, I'm a nurse first, so I love that.
Yeah.
Yes, it was Nurses Week last week. It's Healthcare Worker Week this week, so we're having a lot of fun down in the hospital today, this week.
Yep.
Oh, this has just been a fascinating conversation, and we really do appreciate you guys doing this. Logan Health Patient Family Advisory Council Chair Pete Newberry and Planetree Coordinator Cassidy Lilienthal. Guys, thanks so much.
Thank you.
Thank you.